can you give us some, you mentioned the pandemic, can you give us some sort of the background of how you came to identify aviptadil as a potential in the treatment of COVID-19 patients?
Sure. One of our investors approached us right at the beginning of March and said, we have this molecule that's been sitting on the shelf for 10 years. And one of our scientists thinks that it may have something to do with COVID. Would you look at it? And we looked at the data. They certainly didn't have any data on COVID. But what they had was 20-year-old data showing that this molecule, vasoactive intestinal peptide, and the only difference between aviptadil and VIP is that VIP is a natural 28 amino acid peptide, whereas aviptadil is a synthetically synthesized man-made version of that same peptide. Data going back 20 years showing that this peptide had a very profound effect in the treatment of acute respiratory distress syndrome in the ICU. And the notion was that perhaps it might have a similar role in treating COVID-19 patients on ventilators. So we began looking at it. We became convinced that it was really worth a try. We approached FDA, and within 48 hours, FDA had given us permission to take this into the clinic and treat patients. Within 10 weeks, we had successfully formulated the drug, proven its stability, proven that it was sterile, proven that it was potent, and treated our first patient 10 weeks after we first approached FDA.
So how does it work?
Well, sometimes a picture is worth 1,000 words, and I brought you a picture because it is a slightly complicated story. So it's really all about the lung. And if the SARS-CoV-2 virus, the virus that causes COVID, didn't invade the lung, it would be nothing worse than a bad cold because it doesn't really cause much in the way of other symptoms in the body, except sometimes a fever. But if it gets down into the little air sacs of the lung, then all of the trouble starts. And it's really only a very specific cell in the lung, this alveolar type 2 cell, that is susceptible to the COVID infection. The problem is that alveolar 2 cell has a specific receptor on its surface, like a lock fitting a key. The virus sees that receptor, binds to it, and the next thing you know, the virus is inside the cell, making millions of copies of itself. But even worse, it destroys the surfactant fluid that coats the lung. And without that fluid, the lung can't transmit oxygen. Well, VIP has been shown in hundreds of scientific papers to bind to that same vulnerable cell, to bind to the alveolar 2 cell via its own special receptor. And once it gets into the cell, it blocks the replication of the coronavirus. It blocks the formation of inflammatory cytokines. It blocks the cell death that's caused by the virus. So it's really a guided missile against the damage caused by COVID-19.